This discussion is going to focus on drugs used to treat infections. We're going to be talking about different types of infections, looking at bacterial infections, fungal infections, and viral infections, and the specific types of medications utilized to treat these different types. Now, in looking at the different types of microorganisms that we're going to be treating with the medications that we're going to be discussing in this section, so bacteria are unicellular microorganisms, and they do contain a cell wall. They are able to maintain cellular metabolism, so now what they will do is once they invade a host, they will steal from the host different things in order to sustain themselves. So they'll steal amino acids and sugars and different things like that in order for them to stay alive. Some bacteria, it's important to note that there are some beneficial bacteria. So we commonly think of bacteria as being bad and causing infections, and many of them do. But there are also some beneficial bacteria, okay, most specifically in the gastrointestinal tract. And what they do is allow for the digestion of food, and they actually limit the growth of other bad microorganisms that can cause some harm to the gastrointestinal tract and to the body. The unfortunate thing is sometimes when we treat bacterial conditions with antibiotics, sometimes these bacteria, the good bacteria, are kind of taken out as well, and that could cause some problems, and we'll discuss some of the issues associated with that later on. Your fungal infections, fungus are plant-like organisms, and typically what we look at are the fungal skin infections, most specifically ringworm. There are systemic fungal infections as well that they'll use antifungal medications in order to treat. And then last are viruses. So viruses only really bring with them the DNA and RNA that they need to replicate. Okay, viruses cannot survive without a host cell. So that's going to be kind of important to kind of understand how viruses kind of replicate and how they function in as far as how the medications that we're going to be looking at treat them. And it is part of the reason why, a lot of the viruses that exist outside the body typically don't last very long. Some of them can, but a lot of them don't last very long outside of the body. It just depends on which specific virus it is. So it's important to know that they cannot survive without that host cell for a very long period of time. So the first type of drug to treat infection that we're going to look at are antibiotics. So looking at the basic indications and uses of antibiotics, the important thing with this is antibiotics treat bacterial infections only. Okay, so interestingly enough, a lot of the respiratory infections that many times people run to the doctors with, a lot of times are actually caused by viruses. Antibiotics do not treat viruses. So very important that the person only take an antibiotic if needed, and that's only if their infection is caused by a bacteria. You have to kind of look at the type of bacteria that's causing the infection, because there are different types of antibiotics, and we'll talk about what are some of the criteria for selecting an antibiotic. There's two, general categories of antibiotics. There's narrow spectrum and broad spectrum. Narrow spectrum antibiotics target specific types of bacteria. Okay, so the good thing about your narrow spectrum antibiotics is that by getting that specific, it minimizes any types of bad side effects that you'd possibly have from the antibiotic, versus broad spectrum antibiotics, which treat a more wide range of bacteria. So a lot of times when you don't actually find what type of specific bacteria is causing the problem, a broad spectrum antibiotic will be prescribed, versus if you kind of know what the specific microorganism is, that will call for a more narrow spectrum. Now the problem with the broad spectrum is, again, it will destroy a more wide range of microorganisms, therefore possibly increasing the chance of more side effects. Remember, we talked about how within the body there are also good bacteria that produce a lot of benefits, and many times the broad spectrum antibiotics will destroy those as well and cause side effects, particularly for the gastrointestinal tract. So if they want to be more specific to treat a type of bacteria, a lot of times what will get done is a culture of the bacteria. So wherever the infection is emanating from, a lot of times they'll culture it and they'll stain it. If it's a gram positive, it'll stain violet. If it's a gram negative, it'll stain red or pink. Many times in instances, physicians may start treatment prior to the actual results. They call this empirical treatment, and they will use what's more likely to be effective. So if the clinical diagnosis is a certain type of infection, and a certain type of infection is typically known to be caused by a specific type of microorganism, they'll usually start treatment before the test results come back, and obviously if the test results come back different, they'll change course. Once the microorganism is known, there are 3 criteria they'll use to choose an antibiotic. Okay, so these are the 3 criteria. 1 is the identification of the organism. 2 is the drug sensitivity of the invading organism. And 3, the host factors. So the host being the individual. What are specific things with the individual? Because the person may have either a past health history or something going on concurrently with the infection that might prevent them from using a certain type of antibiotic. So those are the 3 main criteria that they'll use when choosing the antibiotic. So we mentioned host factors as one of the 3 things in choosing, and these are some things that they would consider with the host factors. They would look at, does the person already have an impaired immune system? Is the person pregnant? Okay, there are some antibiotics that may not be suggested for pregnancy. Where is the area of infection? Because depending on where the area of infection is, you may have to use a different type of antibiotic. Some antibiotics are more effective at getting to certain areas of the body, as you'll see when we talk about the different types. So that will be a factor in what is selected. And then other selection will be based on type of infection, site of infection, patient qualities. Again, kind of the same idea of what we just talked about. And then they will select the dosage, how much, how long. It's very important that when an antibiotic is prescribed, that the course is finished. Many times people will start to feel better within a day or 2 of starting an antibiotic. Very important that if an antibiotic is prescribed for a week, 2 weeks, a month, that whole course be finished, because if not, the infection could come back. Now, another type of classification for antibiotics, you have bactericidal antibiotics and bacteriostatic. So the difference between the 2, bactericidal antibiotics directly kill the invading bacteria. So these types of antibiotics will literally go and destroy and kill the bacteria, whereas bacteriostatic keep the bacteria from reproducing. Now what this does is, by preventing the reproduction, it actually allows the immune system to kill the bacteria. And the picture below kind of gives some examples of how, and it actually gives a little cartoon representation of what's actually happening. So if you look at the bactericidal, you see a bunch of dead bacteria surrounding it. The bacteriostatic just kind of has them all tied up and restrained, and gives some examples. And we're going to talk about these different examples specifically and how they kind of operate. Now, with the mechanism of the action of antibiotics, there's 4 basic actions, and they're listed here, various ways of inhibiting the bacteria. So you either have inhibition of the bacterial wall synthesis, you inhibit protein synthesis, inhibit DNA synthesis, or inhibit folic acid synthesis. And as we're going through the different types of antibiotics, we're going to mention what each one of them does. In other words, what's their mechanism as far as how they destroy the actual infection. So probably the antibiotic classification that most people are familiar with, and there's different types of this specific classification of antibiotic, is penicillin. The mechanism of action is they inhibit cell wall synthesis, so they actually destroy the cell wall of the bacteria, and they are classified as a bactericidal antibiotic. The characteristic of your penicillins is they're identified. Their chemical structure has what's called a beta-lactam ring, and there's a picture of a beta-lactam ring both in this lecture and in your book. The beta-lactam ring, or how penicillins get rendered inactive, is by a substance called beta-lactamase, and what this does is it destroys the actual chemical makeup of the penicillin and renders it ineffective. And this is the way in which, when you look at bacteria that are resistant to penicillin, and we have a lot of bacteria right now, and part of this is due to the overprescribing of antibiotics. The bacteria mutate and become resistant to it because they create this chemical that destroys it. So again, another reason why you don't want to overprescribe antibiotics, because we have a lot of antibiotic resistant bacteria, and that could continue to grow as well. Most effective against gram-positive type bacteria, and again, a lot of different types of infections will be treated by your penicillins. So again, effective against gram-positive. I'm sure by now most of you have heard of MRSA, methicillin-resistant Staphylococcus aureus. Part of the reason why MRSA has become a big issue is because of resistance to this drug class. Okay, at one time, MRSA was really only something you saw in hospitals, but now the community acquired MRSA, and even a couple of years ago, this became a really big issue as there were some scares with this. Because this is an infection that is particularly resistant to this class, and it's a very aggressive infection. Typically you see a lot of superficial presentations of this. It causes cellulitis and boils. So a lot of times, if you have really infected wounds that appear to be bacterial infections, it's important that they get cultured for this. Here are some pictures of different examples of MRSA. So, and these could start out very subtle. Particularly the one picture to the right is pretty nasty looking, I guess, if you will. But for the most part, these could start out looking just like basically a little pimple. And a lot of times, one of the very common signs is an expanding reddening area of the skin. So that's one thing you could kind of monitor if you're starting to even think that something could be a MRSA infection, because again, they don't necessarily start out looking just like this. It's something that can progress over time. So again, this is goes to the importance of, even beyond what we talk about in this class, making sure wounds get covered for events. If you're dealing with the athletic population, very important to do that. And here's that beta-lactam ring that we discussed. I mean, again, this is just for your purposes, so you can kind of understand what it is. I'm not going to make you repeat to me the chemistry or reproduce this, but it's just to kind of drive home the point of the connection between the penicillin and kind of its overall makeup. So looking at some common uses, penicillins are both oral and injectable, and probably just about every single person listening to this has probably taken some form of penicillin likely in their life. Very commonly used for ear infections and skin infections. Some other common uses up here: pneumonia, urinary tract infections, gynecological issues. So it's used for a pretty widespread amount of infections. Again, talking about the beta-lactamase, this is what destroys the structure of the penicillin and renders it inactive. And this is, again, one of the ways that our bacteria kind of mutate and become resistant to this type of med. One thing that with a lot of your antibiotics gets added to it is something called clavulanic acid, which inhibits beta-lactamase. So with certain types of antibiotics, they will actually combine this with it to make the antibiotic more effective and to strengthen it. So, and examples of this, augmentin, which is a very common type of antibiotic, it has the clavulanic acid added to it, and we also have Tetracyclines, which is another type of penicillin where this gets added. Again, it just kind of makes the antibiotic more effective because it doesn't allow the beta-lactamase to destroy or render the penicillin ineffective. Another commonly prescribed group of antibiotics are your cephalosporins. They're very similar to penicillins. They actually have the beta-lactam structure, which again makes them susceptible to that beta-lactamase enzyme to destroy it. So again, you have to be worried about certain types of bacteria that have the ability to do that. These are bactericidal, so again, they will also directly kill the bacteria in the body. They're individually be classified by their chemical structure. Again, all of them having the beta-lactam ring. There's 4 different types of generations. What I really just want you to kind of know is that your first generation cephalosporins are most effective against gram-positive types of bacteria. Your second through fourth generations have increased effectiveness against gram-negative and still can also fight against the gram-positive. So they kind of are effective against both. In as far as the effectiveness and what they're typically used for, they're most effective against, again, they treat a lot of skin and soft tissue infections. They work against respiratory tract infections caused by bacteria. They can also be used to treat meningitis, so the infection of the meninges surrounding the central nervous system. They're, as far as forms, they're like penicillins. They're oral and injectable. And as far as how they're absorbed, they're very effectively absorbed, and like a lot of things, get excreted by the kidneys. Your tetracycline antibiotics, these have a broad spectrum of activity. They inhibit bacterial protein synthesis and are considered bacteriostatic. So these don't directly kill the bacteria like the previous 2 we've discussed, but what they do is, again, they inhibit the reproduction, allowing the body's immune system to kind of overcome the bacteria. They treat different types of infections. This is the one that's commonly used to treat acne. Minocycline is an example of this. They're also used very commonly to treat Lyme disease and Rocky Mountain spotted fever, which are infections picked up very commonly by deer ticks. They also work for syphilis infections. And an important thing to know is that the action of these gets impaired with the ingestion of certain types of foods. These should not be taken with dairy products or any type of supplements that contain iron, aluminum, calcium, or magnesium. And aluminum, calcium, and magnesium are common things found in antacids. So it's important that if individuals need to take these, that tetracyclines be administered 1 hour before or 2 hours after the ingestion of anything that contains those products, because those products will actually inactivate the mechanism by which the tetracyclines work. Macrolides work by inhibiting bacterial protein synthesis. They are also bacteriostatic. They're similar spectrum to penicillin, so these kind of help. If people have allergies to penicillin, these could be used in replacement of those, because they essentially kill a lot of the same. Well, they don't kill the bacteria because they're bacteriostatic, but they're effective rather for the treatment of similar types of bacteria that penicillins work for. And one of the common uses are with respiratory infections caused by bacteria. For common types, here I'm going to have you just look this up. If you go to page 124 in your book, there's the general antibiotic summary chart on table 9.1. It will show you what are some specific types of antibiotics, some generic names and name brands of not only this but your other types. So make sure that you review that table in your textbook. Aminoglycosides are another type of antibiotic. They inhibit bacterial protein synthesis. They're most effective against gram-negative bacteria. They are bactericidal, so again, they have direct action to kill the actual bacteria causing the infection. These are commonly used via an intravenous route. There are some other versions of this. A common topical version, which gets used a lot on skin wounds. You probably see it in the athletic training room, neomycin, which is a common topical application for your skin wounds. There's also an inhaled version, tobramycin, with these, but again, the most common way you usually see these is through the use of intravenous infusion, which obviously will be performed in hospitals. Fluoroquinolones have a mechanism of inhibiting DNA synthesis within the bacteria. They are also bactericidal. Again, they will kill the bacteria. They're broad spectrum antibiotics. The kind of the defining characteristic of fluoroquinolones is they're very good at tissue penetration. So a lot of the antibiotics can't penetrate certain tissues and provide the mechanism to actually kill the bacteria. So that's the one really distinguishing characteristic of fluoroquinolones. Their common use is because of that, they're used to treat pneumonia and a lot of your urinary tract infections because of their ability to penetrate tissue. So they're very good, particularly for what would be hard to reach areas for a lot of different types of other antibiotics. There's one big adverse effect commonly associated with this drug that would actually affect a very active population. There's a lot of reports of tendon ruptures with this type of antibiotic, and most commonly the Achilles tendon is involved. So fluoroquinolones have the ability to possibly disrupt the cellular matrix of soft tissue, and even of different types of soft tissue. So therefore, that they do possibly predispose people to tendon ruptures. So that's something to be mindful of. I don't know if there's a big connection between younger active individuals with this, but it is something to be mindful of if in the case you're dealing with an athlete.